I'm honored and excited to welcome the chairman of the Joint Chiefs of Staff, Mark Milley, and our friend, Mrs. Hollyanne Milley. General Milley has the backs not only of our service members, but their families too. He's prioritized all of us, and I'm personally grateful for his leadership. Hollyanne Milley has been deeply committed to many military serving nonprofits, including Blue Star Families and the Red Cross. She's been a leader in the collaborative COVID-19 response initiative across our community. She's headlined several of our town halls over the past year. She's a healthcare worker herself, so Mrs. Milley brings firsthand insight to the pandemic. Thank you both for sharing your personal experience with us today.
Good afternoon to all of our soldiers, sailors, airmen, Marines, Coast Guardsmen, and Guardians, and all of our military families. I'm here with my spouse, Hollyanne, and first we would like to thank the team at Blue Star Families for hosting this informative town hall and for the many programs and initiatives that they sponsor to support our service members and their loved ones. Today, we're here to talk about the COVID-19 vaccine and protecting the 2.3 million men and women who wear the cloth of our nation, and equally important, the 2.7 million military family members faithfully serving by our side. We are both committed to the health and well-being of all of you.
More than 33 million Americans have received at least one dose of a COVID-19 vaccine. As we all have seen, the pandemic has significantly impacted our country. To date, 26 million Americans have been infected with COVID-19, and more than 440,000 lives have been lost. We mourn alongside the families who are grieving the loss of their loved ones, and we are all, as a nation, committed to ending this horrible pandemic together. As a currently practicing healthcare professional who has been a nurse for over 3 decades, the keys to defeating this disease are to maintain our social distance, to always practice personal hygiene, especially washing our hands, and to continue wearing our masks when in the proximity of other people. And finally, now we are administering vaccines to those who wish to take them. According to the CDC, vaccines save lives and reduce the spread of disease. The data show COVID-19 vaccine is extremely promising in immunizing a person against the disease.
The National Institutes of Health state that both FDA-approved vaccines currently available for emergency use in the United States have been shown to be safe and highly effective at preventing COVID-19. Since the beginning of the pandemic, the Joint Force has supported combating the virus by all means necessary. When called into the fight, we commissioned our best talent to aid in accelerated development, manufacturing, and distribution of the vaccine through Operation Warp Speed, a whole-of-nation response. And right now, more than 22,000 National Guard personnel in 33 states are supporting efforts in vaccine administration. With that in mind, getting the vaccine is a personal decision. So we both encourage you to consult your primary care physician to address any concerns about being vaccinated. Arm yourself with credible information about the COVID-19 vaccine so you can be well equipped to make the right decision for you and your family. Protect yourself, protect your families, and protect our communities. Together, we can all lead the way for the nation in the fight against COVID-19.